Hello to everyone watching this video. This is part of the 2021 research conference of the Counseling Master's Degree in Bangor University. My name is Patrikios Pierrakos, and this is a presentation about my pilot study involving the impact of the COVID-19 lockdown on UK counselors and psychotherapists. It is divided in 4 chapters. The first will introduce the background literature that informs the research questions of the study. The second is a description of the method followed to conduct it. And thirdly, the results are mentioned and they are discussed more in depth. So to start off with the background literature, the COVID-19 virus was recognized as a global threat by the WHO on March 11, 2020. Since then, 160 million people have been infected and 3.32 million people have died because of it. However, all these changes have also had serious repercussions for the lives of everyone on this planet. In the UK, self-isolation, economic reorganization, and remodeling of public space were used as an adaptation to the viral outbreak. Production, manufacturing, and all service provision industries have been affected by the virus. On a global scale, GDP rates have fallen, public spending has increased, and unemployment has risen to unprecedented levels. This financial stagnation and sudden halt in productivity has resulted in serious economic troubles for anyone unable to return to work. Inability to pay bills, take care of one's family, and compounded civil unrest have caused serious deterioration in mental health. The health anxiety caused by the pandemic was found to produce post-traumatic stress disorder exacerbation or triggering in individuals with past psychopathology. Social isolation has been demonstrated as deleterious to mental health for many people. Loneliness and poor physical health were known to be closely associated before the pandemic. Lack of social contact predicts a number of negative emotions, as well as rumination, self-reflective thinking, and anxiety. Fear for one's health also contributes to this effect and compounds on already existent stress. In addition to the general population or individuals with previous psychopathology, health workers are also more vulnerable in this time. The tremendous pressure, continuous physical exertion, and constant multitasking associated with healthcare has all but decreased during this pandemic, and workers in this field have been strongly affected by said conditions. Burnout, anxiety, PTSD, and an increased risk of mortality is plaguing health workers during their efforts to treat an increasing number of COVID-19 patients. In this wave of physical and mental deterioration, counselors are being faced with new challenges. Counselors are at the forefront of treating newly triggered or exacerbated mental health problems related to COVID-19. The fear of infection is itself a major stressor for clients as well as therapists. The necessity to continue working is not only motivated by financial insecurity, but also by a strong urge to provide support to those suffering from mental health problems in a challenging socioeconomic context. Along with an increase in workload, the delivery method of psychotherapy needed to change quickly because face-to-face contact increases the likelihood of contracting the virus. This necessity to rapidly adapt to these new circumstances is a stressor for counselors, especially those with no previous experience in teletherapy. Teletherapy can be defined as psychotherapy delivered through means other than face-to-face therapy. That includes the use of email, text, an online form or messaging system, telephone video call, and by post. In terms of effectiveness, studies on teletherapy have demonstrated promising results. From the client's point of view, the quality of the therapeutic relationship and the benefits produced from it are comparable and in some cases higher than in face-to-face psychotherapy. Generally, counselors with sufficient digital literacy, positive attitudes towards digital tools, and more professional self-assurance are better equipped for the application of teletherapy on clients. Teletherapy, however, also poses certain difficulties. The 2 primary issues reported on teletherapy are glitches and technical issues, and the therapist's own attitude towards the method. Glitches, bugs, and lagging are an unavoidable aspect of teletherapy. They can remind the 2 parties of the real distance between them. They can occur at pivotal moments during a session and de-escalate dramatic moments. Another factor that possibly affects counselors during the COVID-19 lockdown is anxiety, which manifests in the work of a counselor and can be seen in their self-efficacy and their work with a supervisor. Self-efficacy can be defined as a counselor's own evaluation of their ability to cooperate with their clients in the present and near future. Self-efficacy can be related to other factors affecting psychotherapeutic work, such as counseling performance. anxiety can negatively affect therapists' relationship with their supervisor. More specifically, it has been found to predict non-disclosure of the counseling experience to a supervisor. This can create unnecessary complications in the therapeutic and supervisory relationships and ultimately produce setbacks in the process of therapy. The purpose of this research was twofold. First, to establish whether the initial COVID-19 lockdown had a negative impact on UK counselors' psychological well-being and relationships with clients. Second, to determine the prevalence of said impact. This assessment was made with the use of 3 scales: the Warwick Edinburgh Mental Health Well-Being Scale, or WEMWEBS for short, the Life Satisfaction Scale, and the Relational Depth Scale. In regards to the methods of this study, 25 participants were recruited in total, all of which are UK-based counselors. Their ages varied between 23 and 71. 15 of them are female, 8 male, and 1 identified as non-binary. They were recruited via email, social media posts on Facebook, and an ad posted on the BACP research notice board. This study followed a repeated measures design. Its independent variable was time, split into 3 conditions: before, during, and after the lockdown. Its dependent variable were the scores produced by the 3 questionnaires mentioned previously. Also, general demographic and open questions were asked after the questionnaires in order to get a clear description of the participants' experience during the lockdown. At first, participants had to fill an information and consent form in order to take part in the study. Then, they filled their questionnaires 3 times for each condition. That is to say, they were asked to recall their experience before, during, and after the lockdown, and then respond accordingly to each questionnaire 3 times. Then, a debrief statement was shown to them, and they read it in order to get general information about the study they just participated in. And now, the results. After the data was gathered, 3 within-subject ANOVA analyses were conducted. The ones comparing the effect of time on well-being and life satisfaction were significant. Post-hoc tests revealed that only well-being had decreased as a result of the lockdown. Life satisfaction actually increased and then remained the same after the lockdown had ended. On this graph, you can see how the means of the life satisfaction scale increased and then continued after the lockdown. On this one, the well-being means decreased and then returned to a similar level. The open questions that were answered by participants identified 3 main themes about their experience. Firstly, anxiety was the most common negative emotion reported by participants. Some participants reported that the lockdown had a positive effect on their everyday mood, noting moments of calmness and peace while in isolation. Secondly, the feelings of anxiety mentioned were connected by many to an urgent need to receive training for remote therapy. They felt challenged by the process of adaptation they had to undergo in order to counsel remotely. Nevertheless, once their clients were moved to teletherapy, participants noted that it was a more effective means than they expected. As the results showed, the study's hypotheses were partly confirmed. However, the lockdown's effect on life satisfaction were not expected. Some of the answers mentioned in the open questions of our study may help explain this result. It's easy to see how anxiety can be linked to a decrease in well-being. The health risks caused by the pandemic and the initial loss of clients produced by the lockdown must have been enough reason to cause worry on a personal and professional level. However, there were also positive moments reported by participants. More specifically, an increase in personal space, more free time, and increased privacy accompanied these positive experiences. A name which can be given to the positive experiences of isolation is solitude. In research, solitude is juxtaposed to loneliness, and whether someone experiences one or the other is dependent on certain personality traits. For example, introversion and less self-reflective thinking are associated with more calmness when one is alone. In regards to the relational depth, which remained unchanged throughout the lockdown, one way to explain this is the effectiveness of remote therapy. It seems that clients moved to this method adapted quickly to this means of communication. It did not seem to disturb the therapeutic relationship. The study had 2 main limitations. First, the sample size gathered was relatively small. However, it was large enough to draw conclusions about the study's research questions. Secondly, because the participants were asked to think about the lockdown retrospectively, this might have caused bias in our data. Nevertheless, it was determined that the lockdown produced both negative and positive effects on counselors, and that despite the sudden changes, their skills and technological assistance were sufficient in order for them to continue their work. And this is the end of the presentation. If you have any questions, please go ahead and ask in the comment section. If you would like to look at the background literature, you can find a list of references in the description section. Thank you for watching.